Hi, I'm Dr. Langley. I'm a family medicine doctor and a lactation consultant and an experienced breastfeeding mom and a allegedly leader. So I've heard of a lot of parents that aren't so sure about what this hand expression thing is. So when it comes to breastfeeding, we lived without breast pumps for a long, long time, and there were times when you needed to get the milk out and baby wasn't necessarily doing their job or good at it yet, or you were away from baby, so you needed to get that milk out to avoid getting mastitis, something like that. And so people over the years have been able to get that milk out, and that's usually called hand expression. I mean, now we have all these fancy pumps that can help get the milk out. But if you don't have your pump, if you forgot a piece, if something broke, this is a good thing to know. It's good to be comfortable with your breasts and how they work, especially when they're lactating. So that's what I'm going to go over today using my handy dandy little breast demonstrator. So times when you might use that we've already talked about. Another time that women are really interested in doing hand expression is when they're late in their pregnancy and want to have a little storage of the colostrum, the early breast milk, to have on hand in case breastfeeding is difficult at first, or in case baby is showing signs of having low blood sugar. Then they already have a little bit of breast milk right there that they can give to baby right away, and everyone can be reassured that baby's getting the best possible thing, but also getting some calories in to make sure that that blood sugar is going up if delivery was a little bit hard or if baby's a little bit big, things like that. So it can be kind of an insurance plan, an insurance policy that even if breastfeeding doesn't get off to the best start right away, you have a little bit of milk that you've already gotten out that you can feed baby right there, and it can set your mind at ease, and you can keep learning these new skills of breastfeeding that both you and baby need to learn. So starting around 38 weeks, ask your midwife or OB what they'd recommend, because there is a thought that if you start expressing breast milk too early, that could bring on premature labor. So you want to wait till you're considered full term and are ready to go into labor, because it just might trigger that. I've never had experience with that personally, but it's possible. So around 38 weeks, you can once in a while try expressing some breast milk and see how it goes. So the way your breast works, you've got most of your breast is full of milk-making glands, and then they all have tubes that run and collect in the lactiferous sinuses, just bigger tubes around the areola. So some women feel like you should be able to press on your breast up here and be able to get milk out. That's not how it works. Women need to press on these sinuses towards the base of the areola, not too close to the nipple, but you kind of have to figure it out yourself, how your own breasts work. So you'll be pressing there. It usually takes a couple presses. Usually it's good to touch your breast, massage your breast a little bit first, kind of like baby does as baby's getting settled into nurse, and that helps to trigger some hormones to help the milk flow. And then eventually, hopefully, you'll get a letdown where you'll have more milk more easily coming out. But that's usually for mature milk. The colostrum, if you're pregnant and getting that colostrum out, you're not going to have a letdown. You're going to have little itty bitty drops of milk that form from the little holes. There's actually multiple holes on the end of your nipple where the milk comes out. And so you'll be pressing here, and you'll try pressing in different ways, in different patterns, in different spots, and you'll begin to start feeling where milk collects the most. You'll kind of feel a bulbous side, especially when your mature milk comes in, and that's where you can kind of massage gently to get the milk out. As soon as you see those precious drops of colostrum, it tends to be really thick and sticky, so that's why this is so helpful for collecting colostrum. Is that the colostrum is just going to get stuck in your pump usually. It's too thick and there's not enough of it to really collect very much usually. So being able to just get a drop or two on a spoon is my recommended way of doing it. And then I take a really small syringe. This is a 1 milliliter syringe. And after I've got a decent amount collected on a spoon, I'll use this syringe to suck it on up. And then I'll get any air that needs to get out there, and then I can suck up some more. And then I'll just stick this whole thing, I'll stick it back in its packaging actually usually, and then stick this just like this in my freezer and save that for when baby's here, maybe even bring it to the hospital, to the delivery with me to have on hand for baby. I'm trying to keep it frozen for as much time as possible, and then defrost it right before baby needs it, just setting it at room temperature in a refrigerator depending on how much of a rush you're in. this is about as much as you could possibly use in those early days for feeding baby. Baby just needs a little bit of a shock of blood sugar, help them realize how delicious the colostrum, the breast milk is, and get things off to a better start. When you have more mature milk, it's going to be a little bit of a different experience, is that you'll have, your milk will actually come and spray out, and it will kind of go in all directions. And that's normal. So you'll be, I recommend, if you're not pumping it, expressing into a pump, maybe like a Tupperware container or a bowl that kind of has a bigger area, so when it sprays, it can be collected from all those sides and kind of pool in the bottom there. And that's a really good thing to know. I mean, there's just times in a breastfeeding journey that you don't have access to a baby or a pump, and you're really uncomfortable. So being able to get milk out, not being afraid of it, not being unsure how it works, is a really useful thing. And in fact, a lot of women find that the breast pump doesn't work nearly as well as their baby does at getting out milk. So a lot of women find that they need to do breast massage like this while they're pumping in order to get more milk out. Some studies find that you can get 50% more breast milk out with hands-on pumping, is what that's called, or massaging your breasts while you're pumping. And that can really increase your output. There's a really great video by Stanford University on hands-on pumping that goes into that some more. I don't want to recreate that video because they did such a great job with it. So hopefully that gets you off to the right start in getting some milk out, whether you are still pregnant or you just want to figure out how your breasts work now that you are a lactating mom. And I hope this was helpful. You'll find some more videos that I've made about lactation and getting breastfeeding off to the right start up there. And be sure to subscribe to our channel here so that you can find out when we make a new video. Thanks!